You're listening to the Exploring Fitness Podcast, episode 15. Today's episode discusses the current shift happening in healthcare so that you can make more informed decisions about choosing the best provider for your personal health needs. In 3, 2, 1, go. I'm Dan Dalator. In over 10 years of experience as a clinician and a coach, I've worked with hundreds of athletes to help them improve their health, wellness, and fitness, but still feel that there is so much more for all of us to learn. This is a podcast dedicated to furthering our understanding of health, wellness, fitness, and how to apply these concepts into our daily lives to create true and lasting changes in your fitness and health. This is the Exploring Fitness Podcast. I'm just going to come right out and say it. The current state of the American healthcare system is broken. We're currently working with a system where 65% of all healthcare dollars are spent on the sickest 10% of the population. Let me say that again. 65% of the health insurance premiums and Medicare taxes you pay every month go towards healthcare spending for the sickest 10% of Americans. Those insurance premiums and deductibles continue to increase at unprecedented rates. Yet, what healthcare providers get reimbursed by insurance companies continues to decrease. This is resulting in unrealistic productivity standards for healthcare providers, requiring them to see more and more patients in less and less time, which inevitably causes a decrease in the quality of care the other 90% of the non-sickest Americans receive, as well as an extremely high rate of burnout for healthcare providers. For these reasons, an increasing number of providers have sought a better method of delivering a higher quality, more personable, and overall better healthcare experience for both the patient and the provider. This movement for primary care providers has been referred to as direct primary care. My next guest is a nurse practitioner who has recently opened her own direct primary care office in an attempt to deliver healthcare services the way she feels is in the best interest of her patients and herself as a provider. Hey everybody, welcome back to another episode. My guest today attended St. Joseph's College, graduating with a Bachelor's of Science in Nursing in 2009. She finished her graduate studies at the University of Southern Maine in 2015 and started her career in primary care pediatrics before transitioning to family practice. She's a mother of 4, and if that's not enough, as a nurse practitioner, she recently opened up Beacon Direct Primary Care back in November of 2024. Brianna Boutin, welcome to the Exploring Fitness Podcast.
Thank you for having me.
Yeah, thanks for being here.
This is great.
This is actually the first ever live recording of the podcast.
First in studio.
First in studio.
I feel very special.
At Infinite Capacity Studios.
Which is amazing. You have a new office.
Yes, brand new office.
It's beautiful.
Thank you.
I love it here.
Thank you.
I'll be back.
Okay.
Because I hurt myself again.
You serious?
Yep. So I'll come back to see you.
Okay.
Maybe tomorrow.
Maybe.
Okay.
I'll see what I have on the schedule. So, first question that I ask all of my guests. I didn't send this one to you ahead of time.
Oh,
so
dear.
It's a little bit unprompted.
Here we go.
But what is fitness to you?
Fitness.
Yeah.
All right.
This is
you threw a wild card at me.
This is the Exploring Fitness Podcast.
So. I'm going to go with the answer that comes to me really quickly, and it's on the heels of a conversation I had with a patient the other day.
Okay.
So fitness to me is really important. And it's important for more than just my physical well-being, for like not being in pain and, making sure that I, don't degenerate and like not be able to do the things that I want to do when I'm older. When I am able to be physically active, it feels like I can get into this meditative flow state, not just while I'm physically active, but for everything else that I'm doing in my life. It's like a foundation that's a necessity for me to be the kind of human that I want to be. And in discussing this with a patient yesterday, we almost both were brought to tears because we think of like our fitness as like a church to us. It's like so important and so sacred to the rest of our life. And she has not been able to do the thing that she needs to do because of some things that she has going on. And so that's my answer, is that it's more than just going and working out and like working on your fitness. It's working on every other aspect of your life.
Yeah, it transcends so many different pieces, like not only just physical, but mental, and sometimes even like the spiritual side of things, like you said, kind of like a
100%.
church. And whenever you can't do that, for those that have been invested in it for so long, like it's almost like a piece of you ends up missing.
100%. I think also when you I'm going way back now to like textbook, when you think of like Maslow's hierarchy,
Oh my gosh.
to be able to like achieve like self-actualization, I think those individuals that are able to do that know that it starts with doing something physical. And once you're able to like do that and run with it, like you can contribute the best of yourself to the rest of the world, which I think is the ultimate goal.
Should be.
I think it should be.
Yeah. There's I can't remember if he's a personal trainer or some kind of like strength and conditioning individual, and he has a saying that strong people are harder to kill and more useful in general.
They're definitely more useful.
Yeah. So I think that goes along with what you're saying. But you mentioned textbook.
I did.
So let's go way back. Like, take us back to the beginning of the journey for you in healthcare. Like, what led you to nursing in the first place? And then, like, why did you decide to pursue that as a career and then ultimately get your NP?
Yeah.
Because that's even a big step, going from BSN to nurse practitioner.
Yeah. I think what you're going to find from me is I'm going to give you like the honest answer, whatever that may be. So where it started is really an interesting question for me because it was never anything except this for as long as I can remember. When it came, like even starting in like high school, I just knew. I don't really know how to explain. It was the only thing that made sense in my brain. It was something that was tangible. It was practical. It just felt right. And like once I made the decision, there was like nothing else like in my purview. That's really it. And, you know, I started, the earliest memory that I have of being in healthcare is working with veterans at a veterans home. And I think early on when I was really impressionable to be able to work so closely, take care of someone so closely, I think that I just loved it so much that it stuck with me. And I was like, how do I do this on like the highest level?
What role was
I was a nurse's aide.
Nurse's aide.
Nurse's aide,
Was
yeah.
Was that high school?
High school. And then it was like, yep, this is it. Like, I think nursing felt right. Because again, it felt like really tangible. And like there was an end goal, I could achieve it. And then it just, at the time, it made sense, I guess, looking at it from like lifestyle when I would, you know, graduate and all of those things. Of course, it didn't quite unfold that way because what happened and what led me to like being a family nurse practitioner now was that I was never like quite I always like I needed to know more. I needed to understand more. I needed to have more control over the outcomes for my patients, which is what ultimately led me into an autonomous position. Was through frustration of I could see very clearly what I would be doing for someone, but to have so many external factors that were like, nope, there's another barrier, there's another barrier. And just this whole time, it's like, but that's not right. Like, that's not what should be done. Like, I want to be making the decision. So that's the honest truth as to like what led me to become an autonomous provider,
Yeah.
to be honest.
Love that. And you spent a significant portion, the first part of your career, in pediatric primary
I
care.
did. That's where I started as an NP.
Yeah. So like peds is your jam, as you say.
It is.
What led you to transition from peds to like entire family practice?
COVID.
Okay.
The breakdown of our medical system through COVID. I also think I would have ended up there eventually because it was just the product of working within a large, very large healthcare organization where it was a business. It wasn't medicine. It wasn't healthcare. It was how frequently, like over and over again in terms of like patients can you see. It was never like, what are the quality outcomes that we're looking for with your patient? So like eventually that would have like led me into figuring out what I wanted to do next. But ultimate like the push for me was after COVID and just kind of the downfall of some of the systems and processes.
Yeah. I think it's almost like natural because whenever you are working with peds, you're working with the parents so much
100%.
like at the same time.
Yeah.
So like why not be able to like treat that family as
Yes.
a whole instead of having the primary communication through the parents
Yes.
while treating the kid, like
Yes.
wrap them all into it.
So family practice so I will always have like something about pediatrics, just it was my jam. I just loved, there's so many opportunities to like influence and help and change. And there's so many people that are usually invested in the care of a child that like when you put the time and effort into making a care plan for someone and you have all of these people that are like, yes, we'll do it because it's for the kid. Like it's so gratifying and it feels like really good. But then I kind of didn't realize how amazing it would be to expand the context in which I'm practicing medicine and like include the entire family. And I wholeheartedly believe, and I think that this might be my Achilles heel. And the only reason why I can like do primary care is I need a ridiculously comprehensive understanding of what's going on with someone before I feel comfortable making a decision. So it makes sense for me to be in primary care and it makes sense for me to take care of like an entire unit because I can make a plan for someone that works within the context of their life. And if something's going on with like a spouse or a child or a grandparent, it impacts your health and your well-being. So I think it's important for me to know that and understand that.
Yeah. And you don't know what you don't know unless you do the digging.
Totally. Yes.
Yeah. Crazy.
Yes.
So starting your own practice, it is a big leap. I know.
Sure is.
From personal experience.
Sure is.
So like what motivated you to ultimately take that step? I know you said that you saw some like broken pieces in the medical system and can you expand on that a little bit?
I can expand.
Or are there other reasons? Too?
Well, another honest answer. I think when I really, really dig deep into what was my motivation for opening my own practice, because I am not someone who I ever thought would be a business owner. I don't even know if like I wanted it at one point in time, but it truly was, my motivation was fear of giving up practicing medicine, which is what I had done, and living the rest of my life without doing it the right way. And it was the only thing that made sense. So if I really wanted to live and practice in a way that felt true to me, this was the only option. I had tried it every other way and it just didn't work. So it was the only logical next step. But if you were, I think, and as a business owner, I think, like, maybe it seems that it should be glamorous and lovely and like wonderful. And that it's not. It's wonderful to be able to like do the things that you want to do without like a net around you and without barriers. But I think like the business owning piece of it is, if I could have someone else own the business and I could just be like, I'm just still going to do everything that I want to do the way that I want to do it, like I would do that. But that's not an option.
Yeah.
Ever.
It always looks glamorous from the outside.
It is.
And then you get into it and you realize how much is involved and how much work it is other than just the seeing patients portion.
Yeah.
Yeah.
But it's worth it.
Yeah,
like
for sure.
All of those things, those like the little like annoying things like have nothing to do with like what you're actually passionate about. So I think that when it comes to, okay, what am I willing to give up in order to do this? Like, I should have done this 10 years ago. I, and I would do it again. Like, if it could be me calling my own shots, I should have done it a long time ago.
Yeah, I hear you. I feel the same way.
Yeah. I think every business owner probably does. I think that they do. If they're
Start a poll.
Let's ask the audience.
Yeah. Polling the audience. Do you wish you would have started your business earlier? So for those who might not be familiar, can you kind of explain direct primary care and how that differs from the traditional like family practice medical model?
Yes, I can. I think it's really simple.
Yeah.
So I'm going to start by saying, so some things that direct primary care are not, is it's not concierge medicine. Concierge medicine is when you go to a provider, whether it is a MD, a DO, a PA, an NP, and they charge your insurance for the services that they provide, but then they also kind of have this a la carte menu of other things that you can purchase with a cash price. And I mean, depending upon the concierge practice, it's like anything from like aesthetics to home visits to being like you can contact your provider whenever you want. But usually those things are like you pay cash, like it's still fee for service. And generally concierge medicine is a bit more expensive for patients, at least from, what I've heard and from what I've read. I have never practiced it myself though. So it's insurance plus the extra. Direct primary care, and I think that I can speak for most of the practices, is the price point is much lower. And it's a membership where everything is included, and the demographic that we try to include all demographics in terms of like who can afford the services. So you still get with direct primary care all of the services that you would expect if you went into a standard primary care office. Like we do all the like medical screenings, and we do the sick visits, and we do the well visits, and we do all of those things, but you don't get a bill from me. It's all included in a monthly bill that is less than like the cost of a cell phone bill per month. And then on top of that is I realize there are two things that we fix with direct primary care. We fix issues with access to care, and we fix issues with communication with patients. So the access piece is fixed because by the nature of the model, we have very small panels. So to put that in perspective, traditional insurance-driven medicine primary care providers on average are expected to have between 2,000 to 3,000 patients that they're managing on their panel. And with direct primary care, it's usually between 300 and 400. So what that does is it gives those patients, you have plenty of time in your day for those patients to come in for visits if they need them. You communicate directly with them. A lot of DPC practices, they don't have ancillary staff or admin that are answering the phones or anything. Like when you call my office, you get me, or if you text my office number, you get me. There's no one else that works with me or for me. So for that reason, I can be really efficient with other people's time. Whereas if you were to, or experiences that I've had is you call your doctor's office and you speak to a patient care representative, which is necessary for these big organizations or at the front desk. The message is relayed to a member of the care team that is then relayed to the provider. And then you hope the provider, in between seeing 25 to 30 patients a day, can get your message, respond accordingly, get it back to the person, and that person will call you back. And it's a very inefficient.
Wait. That's not efficient.
It's not efficient, but with the larger organizations, it's necessary to have that support staff because of the massive amounts of patients that you have. Because no, like not every question needs to be answered by the provider, but I can tell you that if you can have somebody send you a picture of something that they're curious about that they think might be an issue, or be like, hey, like this is bothering me, like what do you think? If you're able to communicate directly with them, you've saved 3 days of your life. Like waiting for a call back, and then on top of that, like potentially like 3 hours out of your day that you would go to an office visit to wait in the waiting room to see the provider, to be like, oh yeah, like that you just need you don't need anything for that actually. Like that's totally fine. That should go away on its own. How frustrating is that for a patient? And also for a provider, because then what happens is probably like the patient's not super satisfied with their care. So they're like, this was terrible. Your communication with your office is terrible. Like everything is terrible. But it's not like anyone's fault. It's the system.
Yeah.
It's just, everyone goes into medicine. I truly believe this inherently, like as they're a genuinely wonderful person that gets stuck in a system that just degrades you as a human being.
Yeah. I think that's why burnout in the healthcare system
It's so
for
bad.
providers is so
And
so
it
high.
wasn't always like this. It was not
No,
always like this.
no, insurance premiums weren't always as expensive as they are right now either. It's just
I don't want to
yeah,
blame. I hate placing blame. Like I want to be, I'm a fix it person, but truly, like I'm sorry, insurance companies, but like they are driving everything right now. If you are being told as a provider, like, listen, we're getting $12.68 for your visit, so you need to see 35 of them a day for us to even consider your worth here as an organization. What? I'm sorry. Like if that's what insurance is deciding that you're worth, of course, as a business, they have to be like, let's go. Like you got to see 60. You got to see 60 a day, or else like it's not worth it to have you here. What a demoralizing experience as someone who
yeah,
spent so much time through school and like just like really looking at what they wanted to do with their life as a human. And it wasn't always like this.
yeah. Same thing on the PT side. Like reimbursement rates are to the point where PTs are having to see like 20, 25 patients a day
Mm-hmm.
in order to be able to meet the productivity standards of some of these insurance driven practices. And it's making the quality of care just tank.
I do also want to make it clear though that it's not, there are several organizations that take insurance that provide wonderful care, and they don't fall to the they don't have, their growth doesn't impact like their quality. Like they're still able to take insurance and somehow provide that balance of quality care. I think it's getting harder and harder to find. But I also don't want for the idea to be that like if you take insurance, like you must not be
Right.
quality. There
Right.
are so many other factors out there that are impacting like what is happening within that organization. I've worked at um, a practice that took insurance, and it was wonderful. There's like, and they worked really hard to maintain their quality. But for me, it doesn't work as a primary care provider. So, back to like the positives, I think like you have access to me. I communicate with you. I think that's standard across the board for DPC practices. Um, and I spend, I would say on average, probably 75 to 90 minutes with a patient when they come
That's
in.
awesome. How
I
much
love
time?
it.
How much time will you be able to spend with a patient before opening your own practice?
Well, um, I would spend more time, and it would be detrimental to me all, all the time. So I think the minimum amount of time that I could physically spend with a patient was about a half hour. But that caused for patients to have to wait, and for those phone calls and those messages to be piling up for me to respond to.
Right.
And it was either you just do as much as you can as quickly as you can, making the best decisions that you can, and then doing things later on in the evening or on the weekends. And it was kind of the snowball effect of
Yeah.
that. But I think that I was just with a urologist last week, and he was spending about 10 minutes with each patient.
Crazy.
Yes. He had no control of his schedule, but that was kind of the expected standard.
10 minutes.
Yes. Yes.
It takes me that long at the beginning of a visit just to catch up with my patient, what they've been doing the last 2 weeks.
I know you have to build some semblance of like
Rapport.
yes.
Yeah. It's hard to do that.
There's no time for that.
No. It's hard to do that and any subjective and objective exam
Yes.
in 10 minutes.
Yes.
So essentially you have about 10 to 15% of the caseload that you are carrying with a larger company.
Correct.
Awesome. Which allows you more time and freedom.
Yes. All around.
What are some of the biggest benefits that patients can expect?
That's a good question.
Like you obviously see it on your side because you get to spend more
Yeah.
time with the individual and because you have more open communication with them. But are there any like hidden things that patients might see more on their side as benefits?
And so I've noticed, and what I really like is I think that it's very beneficial for patients if I'm thinking about them. I have the time to think about them after they leave the office, when I'm doing their charting, when I'm sending a follow-up, like after visit summary to their email. My wheels are always spinning. And because I am no longer in a high pressure stressed environment, there are things that I'm thinking of that are relevant to their life and their care that I can include. And I otherwise would not have the mental capacity or the time to make such like a thoughtful plan for them. And the other thing that I've thought about lately is I really think it's beneficial to my patient when I am not rushed in the morning. I get to be in the home in the morning with my kids. I get to exercise and I'm sleeping. You want a provider that feels so good. Like they will be able to give you more. Like, and that's what I have to give them is like truly trying to achieve a best level of myself so that I can just be like, here's what I have for you today. And it's so much more than I've ever been able to give.
So you can try to give that to them.
Yes.
Yeah.
Yes.
That's awesome. Love it. So obviously every approach or business model is going to have its challenges.
Yes.
It can't all be unicorns and rainbows.
No, it's not.
And as we've
Certainly is
discussed,
not.
like you are the admin, the provider, the biller,
Yeah.
you hold all the hats.
Yeah.
So like, are there any other specific challenges that you've noticed since starting your practice in November?
So I think there's one specific challenge that's unique to the DPC model is that we have to keep our overhead really low, or else the model doesn't work. It crumbles, which just basically means we have to minimize our expenses the best that we can. And that's been a challenge, especially during the startup phase of all of this. And I think that naturally kind of leads into like I do everything from cleaning my office to drawing my own labs to setting up my own labs to as soon as the patient calls, texts to as a new patient, like I'm the one communicating with them. I'm requesting their records. I'm reviewing their records. I'm inputting everything into their EMR. So that is a challenge. And I'm dealing with that by making sure that I'm growing in my practice is growing in a way that's slow and sustainable. Because, the fact of the matter is if I get 20 new patients a week, I wouldn't be able to sustain that. And the quality would suffer. Like they wouldn't be able to hear from me because I'd be doing all of these things. So I've realized that a sustainable growth is probably no more than 4 new patients a week. And even that is like a lot.
Whoa. Rein back a little bit.
Just because of the time I am trying to quantify like how much time is spent with a new patient, like onboarding them. And it's a lot. I want to say 4 or 5 hours a week. maybe.
per,
But then
per
there's like,
patient.
yeah, but then
Yeah.
there's like the continued care once they're there. And I can't quantify that yet per week, but it's a significant investment of my time. So I have to be careful.
Yeah. Slow, steady growth.
Yes,
It's a marathon, not a sprint.
for sure.
Yeah.
Probably a couple marathons
Back to back to back. I have trouble running one marathon.
This is my first one.
Well, you're doing great.
Thanks.
Yeah. Slow and steady. So we've talked about some of the problems with the traditional insurance-based model. Do you think that the direct primary care model is the future of healthcare?
Is 100% the future of primary care. I know that. Like, I feel it in my soul.
I feel like there's enough direct primary care offices popping up.
There's so many. And every new one, it makes me so happy to see it.
It has to be an indication.
It makes me so happy to see it because it means, gosh, it means another place for patients to go. Because if we are only able to, because our panels have to stay small, like there's no way around that. And that means that we need more practice models like this. And I think that it is a very, very logical way forward to help decrease overall healthcare costs. If you have enough direct primary care practices, you will for sure have less patients using the more expensive services like urgent care and the ER and being hospitalized. That's the whole
unnecessary diagnostic
point.
imaging.
Yes, Dan.
Yeah, that's my soapbox.
I've decreased my imaging since we've been working together. You should be very proud of me. It is the way forward for preventative medicine. And a challenge is quantifying that financially, which is why there's like no real investment in primary care or DPCs, except for Taro Health. They're willing to invest in us because it's really hard to take a patient and be like, okay, this provider, they should get $100,000 because their patient didn't have a stroke, right? Because they work so closely with them that the hospital didn't incur this like bill and insurance didn't incur that bill. That's really hard to quantify. But over time, you will see more of these practices and you will see the healthcare costs individually go down and on a larger scale go down. But it's going to take a while. I think it's going to take like about a decade for us to actually tangibly see that.
I think typically research is about like 7 to 10 years behind, or sorry, in-person care is about 7 to 10 years behind where the research is. So I could definitely see it taking about that same amount of time, conversely, to be able to get those numbers about what's happening right now.
Yeah, that's just kind of a instinctual feeling I have. And also from just like being in medicine, kind of seeing how long it generally takes for us to have like
I wouldn't be
good
surprised
evidence.
if it takes longer.
I'm trying to be really hopeful. 10 years. We'll see it.
I love being hopeful. We'll see. I don't have faith in the medical model.
I think that we have to let it break. There are sometimes.
I think it's close.
I think that there are still so many good people trying to hold it up and glue it together and piece it back together. And I think you have to take a step away and just be like, you know what? Go ahead, break, because I can't hold this up anymore. And if enough people do that, then you are forced into creating something different. And I think that that is what direct primary care providers are doing. Not just me. I think every single person that has stepped out to do this model is brave and they are figuring out a way to do things better.
Yeah. And they're there to catch all of the fallout when things break.
Not all of it, some of it.
A majority of the fallout.
Majority.
Right. So for anybody listening who's interested in the direct primary care model or has been thinking about potentially making the switch to the model, like what would you say to them? How can they get started? do you have any resources that they can go to find out more?
Yeah. So this is simple. In regard, I do want to say though that if you are in an organization that is insurance based and you have a PCP that you love and you have access to them and it is not a high cost for you, then stay with them. They are gold. Stay with them for as long as you possibly can. You might not be somebody who would needs this model. But if you are someone who is like putting off medical things or even questions that like you think might be medical that aren't medical, but putting off care at all because of your frustrations with the system, when it even begins with just calling the office for an appointment. If you're that person, if you're someone who you see a different provider every time you go in to see who's supposed to be your PCP, or if you are someone who you don't trust your provider or you don't feel like they have like heard you or listened to you or like knows you, if you are someone like myself who had spent thousands of dollars at urgent care because you can't get in with your provider, DPC is for you. And if you're just looking for longevity, that's like, it gives me goosebumps to think about this. But there is like this lovely return of like an old school feel of medicine that we're able to do with DPC, which means like I am going to be doing this for the next 30 years. And wouldn't that be so lovely to kind of go back and just be like, oh yeah, like my provider is the same one that sees my child, is the same one that saw like my mom. Like, isn't that so wonderful? That's what we're trying to do. That's what we are doing. So, and if you want that for your whole family, then come see me. But there are also, I just want to say there's so many other amazing DPC providers that are just doing like wonderful things. There's, Amy Brown and Phil and Oren Gersten, and then Ben Hagopian, who just started a longevity piece of his practice.
I've heard.
Like amazing. And like he can do that, which because of like the model allows for him to be like, all right, how do I take this to another level? And they're just everywhere. And I really think everyone could benefit from it, truly. But if any of that appeals to you, then DPC is for you. And it's really not that expensive. On average, I think the membership costs are between like $100 to $150 for an adult. For kids, between $60 to $80 a month, and that's like with everything included. So I think if you like want to make that investment in your healthcare, I think it's an easy yes for a lot of people when you take a step back and be like, how much am I spending on Netflix and my cell phone? And like it's a no-brainer to do it for like your health as well. But make sure
for your health.
Make sure it's with someone that the point is to find somebody that you trust and that you have a connection with, and that you feel like I think that you should feel like you're getting more than your money's worth when you find the right person.
Love it. So where can people go to find out more about you and your company, Beacon Direct Primary Care?
Well, they could text you and you could give them my number. Or they could go to my website at beacondirectprimarycare.com. And then truly it's mostly call my office or send my office number a text and I'll get back to you, because I always end up talking to every person either on the phone or we do a virtual meet and greet. I have all the fancy like links, but people want to talk to me. Right. So my office number, I don't have it off the top of my head, but
okay. You have social media, right?
I have social media. Yes,
Instagram.
I do.
Yeah.
Yep.
What's your Instagram handle?
Beacon DPC.
Beacon DPC.
Yeah. You could send me an Instagram message.
Send an Instagram message. Give her a call.
Call me.
Perfect.
Ask
Brianna.
Dan for my office number.
Yeah. Ask me. I can get you in contact with Brianna. Perfect. Well, thank you again for being here.
Thank you for having me.
Yeah, so much fun.
This is great.